Live yet? Good evening. My name is Jo, and I am an occupational therapist and CEO at Starjumpz Children's Centre. And I'm here this evening with Carrie Bartlett, who is a child and adolescent psychotherapist. Carrie, would you like to introduce yourself before we start?
Sure. So hello, Jo. Hi, everyone who's joining us. My name is Carrie Bartlett, and as Jo said, I'm a psychodynamic psychotherapist. I specialise in work with children from birth all the way through to 18 years old. And I work at Starjumpz.
Thank you, Carrie. And can you tell our audience what made you decide it would be a good idea for us to talk about psychotherapy tonight?
I think it's something that's come up quite a lot where I'm meeting parents who are concerned about their children and are desperately looking for help for them. And what's happening is that it's a really confusing field. There's lots of different types of psychotherapy and counselling out there. And so I hoped that having a talk on psychodynamic psychotherapy would help to demystify what it is and who it can help, and the way that we work, because I think parents who are already quite worried and looking for help, that could be really helpful to have a think about that.
Thank you, Carrie. If you're on Facebook watching us live, if you want to text any questions you have, I'll be able to see them and put those to Carrie. So please do feel free to ask any questions as we go along. Psychodynamic psychotherapy is quite a mouthful and quite scary sounding, Carrie. So what is it?
Yeah, it is a mouthful for sure, and it does sound quite daunting. But really what it is so it's a one-to-one therapy generally. Certainly at Starjumpz, it's one-to-one therapy, and it's all about the interaction between the child and me. And what we understand in psychodynamics is that behaviours all have an emotional basis. So what we're looking to do in psychodynamics is to understand and uncover what's going on behind the behaviour, which might be bringing the child or adolescent to psychotherapy in the first place. For instance, a child with OCD, they might be feeling really overwhelmed. They might be feeling like their world's pretty chaotic. And so the rituals of OCD help them have a sense of control. Just as an example, so we would be trying to understand those overwhelming feelings, make sense of them, process them in a really healthy way, and then hopefully the symptoms there'll be relief from the symptoms. And actually, I think that's true of physical symptoms as well. So headaches, tummy aches. I do see a lot of children who suffer with a lot of tummy aches and digestive issues, and that really gets in the way of their day-to-day life. Of course, we need to rule out a physiological issue behind those, but from a psychotherapeutic point of view, there can be roots of anxiety and physical manifestations of anxiety. So really what we're trying to do is just get right to the root of what's going on for that child to provide relief and help them move on in a healthier way.
Lovely. Somebody has asked, what ages of children can you see as a psychotherapist?
So right now at Starjumpz, I see children from 5 all the way up through to 18.
Lovely. Thank you. And how is psychodynamic psychotherapy different from other kinds of therapy or psychotherapies?
So as I said, there's all sorts of different types of psychotherapy. There's lots to choose from. Some of them are shorter term work, and some will focus on like one specific behaviour and really sort of tackle one behaviour. In psychodynamic psychotherapy, it tends to be longer term work, because, as I said, we're really getting underneath to what's going on, and that can take time. And it's very, in psychodynamics, it's very client-led. So within the parameters of safety, the child is able to do or say whatever they would like in a session. And so it's my job to sort of tease apart what they're bringing to the session and help them make sense of it. But I don't have tasks or goals or homework for the child to do either in the session or in between our sessions. So it's very fluid. It's often a very creative space. And yeah, the emphasis is on insight really and understanding. And that's not generally a linear journey. It has lots of peaks and troughs, and it's my job to work with it.
Okay. So this type of therapy is appropriate for children and young people, as you've been saying. And is there a reason why psychodynamic therapy works so well for children and young people?
Yeah, I think it is really appropriate for children and young people, because I think the fluidity of it is very appealing to children and to adolescents. As I said, it's incredibly creative. They can say and do whatever they want, and that can be quite appealing, I think. And it's an adaptable technique. So for younger children, perhaps those who are in primary school, we have a range of resources, and I'm going to talk more about that next week and have some things to show you. But we have some things that they can play and work with, so it tends to be more play-based. For adolescents, it tends to be more conversation focused. So it's highly adaptable. And I think because we're looking at sort of the emotional root of behaviour, we're looking at sort of early experiences and early traumas. And when a child or adolescent is accessing therapy at that age, something of the therapeutic journey becomes internalized, and they can carry it with them throughout the whole of their lives, really. So we're building resilience early, and I think by having a really good experience of therapy at a young age does mean that when a child becomes an adult and maybe they want or need counselling or therapy again, they've had a really good experience, and so it becomes less scary to reach out for help. So and I think the last thing I would say on that is also that we provide a very consistent space. So we have sessions on the same day at the same time for the same duration every week. And for anyone, but particularly children and young people, I think that really creates the sense of safety that somebody's going to be available to me at this time for this long. And that's really comforting, I think.
Can I ask, in terms of the length of the therapy, number of sessions, you've mentioned sort of shorter term therapy and longer term. Can you say what the shorter term how many weeks that might be compared to the longer term? Is there a sort of guide to that? That is what you will be looking at the outset, but perhaps you could just explain a bit about how you decide whether it's short term or longer term, and what sorts of things you might work with in either.
So for the shorter term work, the shortest model I would offer would be 24 weeks. And that's very suitable for children who are perhaps coming with an issue of a moment in time, such as exam stress or transitioning from not just primary school to secondary school. They might be changing schools for some reason. The longer term work would be for children who are experiencing more complex mental health issues, but it's something that I would be very regularly reviewing with parents and with the child themselves to see how we're progressing. And I think when we are coming towards an end, and again, this is something I'll talk about more next week, but it's something we really work towards, and it's a very thoughtful process.
Thank you. Somebody has asked, if their child's had a different kind of therapy, can they then switch to psychodynamic psychotherapy?
Yeah, absolutely. I think what I would say about that is that, as with any change or any major goodbye that we have, having a break is really important. So if you think about the summer holiday that happens between the year sixes who are leaving primary school and then going on to secondary school, that 6-week break is really important because a healthy mourning process happens. So I don't think it's a great idea to jump from one therapist to the next in a week. I think a little bit of a break happens, and I think that break would probably be relative to how long they've worked with their last therapist. I think it'd be really important to let your new therapist know that they've had a therapist before, because for me, it's something I would want to perhaps bring up with the child. As I said, therapists work in all sorts of different ways. So I think I'd be wanting to say, oh, your therapist might have done this differently, and I do it like this, and explore what that's like for them. And also, if the parent and the child are comfortable with it, it can be really helpful for the new therapist to just have a brief conversation with the old therapist and kind of get a sense of what was going on in the work and their insights. So absolutely, yeah.
And at Starjumpz, sometimes children who might be seeing you might be seeing another therapist at the same time for a different kind of therapy, like, for example, occupational therapy or speech and language therapy. Can you talk a little bit about that?
Yeah, so as you said, at Starjumpz, we often have multidisciplinary working with a child. And I think if it's sort of a non-psychological therapy, so if it's physiotherapy or speech and language therapy, then that kind of multidisciplinary thinking is really helpful. I would hesitate to see a child who's accessing another psychotherapist every week. I think that could be really confusing for the child. But there are instances where if they were having group therapy elsewhere, then, having simultaneous psychotherapies might be okay.
Can you give us some examples of the kind of presenting problems some of the children that you would see might have?
Yeah, there's a huge range of presenting problems that psychotherapy can help with. Like I said, some of it is a moment in time. And because we're really looking at how and why we think and feel the way that we do, we're also looking at how the child relates to other people and how they relate to themselves. And so seeing children who have peer relationship issues often come to psychodynamic psychotherapy. Children who have experienced bereavement or divorce. It's also suitable for children who have self-harmed or who have worries or feelings about suicide or have attempted suicide before. So there's quite a range of presenting issues that we see in psychodynamics.
Thank you. If a child has a pre-existing diagnosis or any diagnosis, I would imagine that doesn't stop them from receiving therapy. Are there any diagnoses or conditions that wouldn't be appropriate for this type of therapy?
I think I would think about it on a case-by-case basis. So absolutely, children with a quite a range of existing diagnoses come and see me. And I think they get a lot out of psychotherapy. I'm always keen to talk to the other professionals who are involved with that child. So with parental permission, and where appropriate, the child's permission, I'll link up with their GP if they're having medication, or, as we said, any other therapies that they're having at the same time. But also, I think in psychodynamics, there is a school of thought where we can look at some of the presenting issues of pre-existing conditions through a psychotherapeutic lens, and that can be really helpful, I think, for children with existing conditions.
And clearly, you don't have to have a condition or a diagnosis to benefit from learning to be more to navigate this challenging world that we're living in right now, by having that kind of support and guidance, way of empowering yourself.
Yeah, absolutely. I think that the
mental health support has really grown from what we're seeing at Starjumpz over the last few years. I think every group, and certainly that has impacted children and young people quite significantly. I don't know if you feel like you've seen that, Carrie.
Yeah, sorry, Joe, you were breaking up a little bit. Were you talking about COVID?
Just missed what you said there. I think the internet cut out. I don't know if it was just me.
No, sorry, Joe, I didn't quite catch what you said.
Oh, sorry. I was just saying that I feel it's been quite a traumatic period the last few years, and it has really impacted children and young people very significantly. And I don't know if you've noticed that in the children that you're seeing recently, and over the last year or so.
Yeah, very much so. And I think that's I think that's being seen in the trend of referrals that we're having, children who are really worried about their own health and the health of their close family members. You know, this isn't something perhaps pre-COVID that would have necessarily come up. And I think one of the reasons I keep talking about transitions in schools is that a lot of our children have missed out on a huge chunk of not just their education, but also the psychosocial aspects of school. And so big events, exams and changing schools and their relationship with their peers, I think has been deeply affected. So as we were saying, there doesn't have to be a formal diagnosis of anything to come and see psychotherapy, come and see a psychotherapist. But I think we are seeing the impact of COVID on the mental health of young people, very much so.
So how would someone go about accessing psychodynamic psychotherapy? What's the process?
So at Starjumpz, when an inquiry is made, then the admin team will send a general referral form out, and this has all the child's details on and a chance to sort of give a brief summary of what your concerns are. And then I offer a free 15-minute introductory phone call. So it's a chance for me to say hello and introduce myself. Maybe I'll have questions after reviewing the referral, so I might ask about that. And it's a chance for parents to also ask any questions for me. And then we go ahead with a 90-minute meeting. So I meet with the parents on their own. And this is a chance for me to really understand their child's background. So I take a full developmental history and think with the parents about what their current concerns are for their child. And it's a chance for the parents who haven't been to Starjumpz before to see the centre, meet me, see if I seem like the right therapist for their child, of course. And then I usually offer 3 exploratory sessions first. So these look much like a therapy session, but it's a chance for the child to get to know me a little bit, become a bit more comfortable in the therapeutic space. And it's a chance for me to also see how the child responds to psychotherapy. And then I meet with the parents and we discuss the best way forwards after those 3 exploratory sessions. And that might be going ahead with weekly regular sessions with me. Sometimes for various reasons I might refer children on. But I think the really important thing to take away is that from the moment of inquiry, then the parents aren't left. We find the right, best possible support for their child, and we'll work together and think together about where that is, whether that's with me or whether it's perhaps involving other professionals at Starjumpz if we need a different assessment of some kind. But yeah, they're not left at any point. We find the right place.
Yeah, and it might be signposting them to other services as well.
Yes.
Outside. Yes.
Yes, absolutely.
So you work quite closely with the parents throughout the therapy work that you're doing.
Yeah, I think it's really important in my practice that I do that. And next week I'd like to talk more about what the role of the parent is in psychotherapy. But I think when I'm working very closely with parents, there's a collaborative thinking going on around their child, and that can lead to something really transformative and very powerful, I think. I offer, so once regular weekly sessions have begun, I offer parents 6 weekly reviews. So it's a chance for us to really get together and think about their child's progress. I'm always interested to know how their child is responding to coming to their sessions and how they feel afterwards. And it's a really good opportunity for us to think about anything new that's come up or any changes that have happened. But I think it's vitally important to work with parents.
Yeah, no, absolutely. Can you tell us how confidentiality works? Because I understand you see the child one-to-one. So how does what happens in the session remain confidential? How does that work?
So I believe I can say with confidence in all psychotherapy, confidentiality is very key to what we do, because it allows a really trusting therapeutic relationship to build up. And sometimes throughout the course of the journey, children are bringing very painful feelings, very private feelings, sometimes quite unpleasant aspects of themselves to the therapy room, and they need to know that the space is judgment free and is kept private. So what I do is, in the very first session when I meet a child, I explain their ethical and legal right to confidentiality in child-friendly terms.
Yes.
But there are limitations to what I can keep confidential. So I also explain to them that if I was worried that they or somebody else isn't safe, that I would have to let their parents know, or somebody at Starjumpz. But I always reassured them that I would tell them that first. So this is something that's an ongoing discussion with the child, but it's made very, very clear from the beginning. When I'm meeting with parents for reviews, as I said, I think that collaborative thinking is really important. So I am able to talk about the key themes that are coming out of our work, but I won't go into the details of how I got there. For example, if a child, I don't know, made a mess in the therapy room, this is made up, but the child made a mess in the therapy room, and I realized that they were really distressed by this, and they thought that this was a catastrophic mistake, then it's something I could say to the parents that it seems to be in the child's thinking that little mistakes can't be repaired, and this might be why they're worried about exams.
Yes.
And so the parents then can take that and sort of be aware of it throughout the week, and it informs the parents' thinking then.
Yeah.
And so the therapy work then continues. outside of the therapy space. So I think, yeah.
I can imagine, as a parent myself, that it must be quite hard for some parents who really want to know as much as possible how to help their child to actually be able to be collaborative and not too keen to know the details.
It does happen. It does happen.
Yes.
But I think actually by holding that boundary sort of instills that trust that I am there for their child and I take the work very seriously. And I think that knowing that I will share key themes and will share my insights, I'm not keeping that to myself.
Yes.
I think that helps to sort of, you know, parents are often coming to me really confused about what's going on for their child. And so I think it helps them to feel held within our service as well. Not just there for the child, we're there for the whole family, really.
Do you work with children who are adopted or looked after as part of your therapeutic work?
So there are, it's a really good question because there are laws around adopted children. So currently the legislation says that if the primary reason for the referral is adoption, then children should be seen by a specialist adoption counsellor who's registered with Ofsted and has done specialist training. That's not me. But if children have happened to be adopted, but that's not the primary reason for their referral, then yes, they can come and see me. But I think it's always helpful, and I always let parents know that they have a right to go and see a specialist adoption counsellor. There are no such guidelines around looked after children. So yes, we do work with looked after children as well.
Yeah. And we do have a therapist who's joining the team who does have some specialist experience with adoption as well. I think you're meeting this week, actually.
Tomorrow. Yes. I think I'm looking forward to it. Yeah.
You spoke about the importance of having a consistent schedule for therapy. And you did mention the holidays. Is it okay if a child is doing a course of therapy for them to have a break?
Yes, of course. Yes, families go on holiday, and I think the breaks are they're really important in therapy, because I think when we take a break, just like when we say goodbye to our last therapist, as we talked about, a lot of integration can happen and a lot of processing can happen. I like to manage breaks very carefully. So for any child I'm seeing, I'll give as much notice as I can. So about 3 weeks before, I'll let them know that a break's coming up. For younger children, I often make a calendar that shows how many sessions we've got left, and then when our break will be, but most importantly, when we're going to come back together, so that they can see that we are going to come back together. So I think particularly for children who have had experience of a traumatic separation of some kind, like a bereavement or estrangement of some kind, managing those breaks it's really important we hold in mind what that might touch on for them. And of course we do have little upsets. Children sometimes get ill, or I might get ill and we're not able to meet for a week, and that's something I really try and talk to the child about. So I would be wanting to explore with them what it was like that we missed a session if it was an unplanned one. But yeah, I think holidays and breaks are really important for everyone.
Can you do any of your sessions over Zoom, or your reviews with parents over a Zoom appointment?
Yes, and I think it's interesting we talked about COVID, because I think COVID really challenged us to find creative ways of reaching our clients when we couldn't meet face to face. In terms of parent work, I like to meet the parents first face to face. I think that's really important that we're in the centre and we meet there for the first meeting, but I often do parent reviews over Zoom, the regular ones every 6 weeks over Zoom. For children, personally, I see children from 13 upwards over Zoom. As I said, it tends to be more conversation based, and that's difficult. It's difficult to have play-based therapy over Zoom.
Yes.
And I think it does require a lot of thought. If the teenager has any risky behaviours, it might not be appropriate to see them online. So again, a case-by-case basis, but I think it can work really well for some children.
Well, I think we've just about gone past our half an hour, and I can't see any more questions for now. If anybody would like more information, please email us at info@Starjumpz. And next week, we will be doing another half hour where Carrie will be talking about what happens in a therapy session. She's going to show us some of her lovely resources and how she might use them, and also talk a bit more, I believe, about the role of the parent.
Yes.
Is there anything else you want to say about next week?
No, I hope you'll tune in because I think this is something that parents often come and ask is, well, what does it look like? What do we do? So I think it's going to be a really great chat.
And if you can't be with us in person but want to ask a question by email to us, if you put attention Carrie in your email to Starjumpz, then we can ask Carrie the questions next week and hear from her. So thank you very much, Carrie, for your time. And I'm looking forward to talking again next week. Take care, everybody, and have a really good evening. Good night.
Bye, everyone.